Many parents of children with autism want to leave things to the professionals and just want to be a parent. But I think during COVID, that all changed when most of the kids in the whole United States and the whole world came home for a few months. So today we're talking about parent-led therapy and how it can really change everything. Hi, I'm Dr. Mary Barbera, autism mom, behavior analyst, and best-selling author. Each week, I bring you some of my ideas about turning autism or signs of autism around. So if you haven't subscribed to my YouTube channel, you can do that now. Today, we're sharing an excerpt from podcast 222 with Marie L. She's the mom of two school-age kids, both diagnosed with autism. And Marie didn't really know that there was so much she could do when her kids were in preschool, and kind of got into a lot of dilemma, both when they were in school and then when they were sent home from school during COVID, when she was caught with needing to learn how to teach them. So Marie's made a lot of gains, as her kids have made gains too. And today we're talking about that. So in the past 3 years, what kind of gains did Sean make?
He's up to 300 words. He goes to the hairstylist every 2 weeks. He can sit there without me holding him or anything. He sits with his balloons now and his little bluey, and he has his haircut, very cute. He's going to a personal trainer. He's out more. He helps me with groceries. He helps at the, even just doing chores. Like if he, gets his shirt dirty, he'll take his shirt off, he'll change his shirt, and then he puts that shirt into the wash, which is, again, like huge.
Yeah.
So there's a lot of, again, little things, but when I started your courses, again, it's like I told my husband, we're focusing on self-care. And he brushes his teeth at night. He makes sure he's completely independent potty, making sure he can completely dress himself and stuff. And, we focus a lot on the mans and the tax as well, and the echoics. But I was really kind of honing in on this past year, making sure we're kind of doing that because I want him to be happy.
Yeah. And a lot of times parents and professionals, I think they focus, I did it myself, focus too much on language and not enough on self-care and life skills.
Yep.
Because, those are super important, especially as your child gets to be 7, 8, 9, 12, 15. Language is great. And the fact that he can request or demand for, or tact 300 things and probably more than that, starting to answer questions, starting to, be involved, but like going to the grocery store, going to church, going to a restaurant, going on a plane, those are all huge goals that make more of a difference in the child's safety, independence, and happiness, and the families.
Yep.
Than, 4-word sentences, which really doesn't do much for safety, independence, or happiness.
Yeah. One other example I could think of is, the oxygen.
The O2 sat machine for the.
He was petrified of that. So we had one that was, oh my God, I think it looks like a shark, and he's just petrified. No. And it's like, okay, we're going to work on it. So I made sure the reinforcement was extremely high. Every day it was like, working. And then he went to his doctor's, and the nurse put it on. She goes, is this the same kid? Like, yeah, it's fine. Yeah. But he is so good. And just for him, that was huge, because that was the one thing he couldn't stand at the doctor's. But he's just it's amazing how much he's grown. And at his developmental doctors, he goes, I'm all good. So he'll let you know if he's all good.
And how about aggression? Are you seeing any of that?
We're not seeing much aggression at all. No. If he ends up with a migraine, we might see a little aggression, but no, we're not seeing any aggression. And migraines are migraines.
Yeah, and medical problems are a big
Right.
part of why some kids like Lucas had aggression and self-injurious behavior, and he still has SIB for pain or startle, mostly pain. So it's really important that we as parents really try to figure out any pain and try to figure out what med might help things. I hope you enjoyed that excerpt from podcast 222. If you did, you can listen to the whole podcast episode. Check the link below for all the details. And for more information to join our online course, either the toddler course or the new Turn Autism Around for School Age course, you can attend a free workshop at marybarbera.com/workshop, find out all the details and take action starting today. And I'll see you right here next time.